Most times when you go to the doctor, you always get your blood pressure taken. Now, when you were little, you just thought it was a band that went around your arm and squeezed. Well, it's actually a measure of the pressure of your heart when it's resting and the pressure as when it's beating. And when you have a high blood pressure, it can actually cause issues like kidney failure, heart failure, and all that. It can cause a lot of major issues. So knowing how to take a blood pressure can actually save someone's life, learning how if they have high blood pressure. So I'm going to show you how to take one. First, you'll need a blood pressure cuff and a stethoscope to hear the heartbeat. And you're going to go up to someone and you're going to wrap it around their arm. Now there's a thing that says artery, and that's where you're going to want to try to aim for, around their arm. You don't want it too snug, but snug enough that it does kind of squeeze a little when you're first putting it on. Now when you read a blood pressure, you look at these numbers, and the first heartbeat you hear is your systolic, which is your heart beating, and the bottom one is when your heart is resting. Now when you do this, you want to keep a close eye on them, because getting them wrong can actually cause major issues and can be bad. Now listening for it, you always want to put the stethoscopes like right in the bend of the arm and have the person relax their arm. Now there's a pump, and on the pump there's this dial that you turn back and forth to tighten and loosen the pump to let the air out. You don't want to go too high, you want to go to about 200 and then slowly let air out. Now as you listen, you want to listen for the strongest heartbeat and when it starts and goes again. Now the best blood pressure is 120 over 80. That's what most people want to try to go for that's the healthiest. Now Emily's was 122 over 90. The bottom one's a little high, but that's not bad. You want to report anything over 140 and over 90. And that's how you take a blood pressure.